Our guest for this segment is Dr. Ariel Ostad, who is a dermatological surgeon in private practice and clinical associate professor at the NYU Department of Dermatology. Welcome to the program.
Thank you.
And as I've advertised, the subject is lasers and skin cancer, so I'm going to let you just take it away for a minute and talk about what kind of lasers we're talking about and what kind of skin cancers we're talking about.
Primarily we're talking about the Fraxel laser, and the skin cancers we're talking about are non-melanoma skin cancers, primarily basal cell carcinomas as well as squamous cell carcinomas. I would like to start out by talking about precancers, which are typically called actinic keratoses. Majority of basal cell as well as squamous cell cancers arise out of these existing precancers, which typically present on the skin as these scaly red patches where when you touch your scalp or your face, you typically run into some rough areas. And those are precancerous lesions which, if untreated, can go on and develop into these most common types of cancer, which account for about 95% of skin cancers, the basal cells as well as the squamous cells. And with new technology such as Fraxel laser, one can very effectively get rid of these precancers and therefore avoid skin cancers.
Now, these kinds of early or precancerous lesions, as you call them, are fairly common, and haven't they been widely treated with cold treatment or nitrogen treatment and with scraping and biopsies, etc., also effective?
You're absolutely right. Currently, the basic standard of treatment is to treat these actinic keratoses, these precancers, with either freezing them with liquid nitrogen, cryotherapy, or application of these creams which mainly contain 5-fluorouracil. The drawback to these treatments is that patients are typically, with the freezing, are left with about 5 days of downtime where the area blisters and scabs. And in addition, the creams typically take about 2 weeks to really do their work, but by the end of 2 weeks, patients typically have severe scabbing and almost second-degree burn, and there's a lot of discomfort associated with these treatments. With the freezing method, typically you're only treating spot treatments when what you can actually see on the patient, and you're not really getting rid of any underlying sun damage, and therefore it's not the most effective treatment. With creams, the main primarily drawback is the fact that patients who are typically active, they're social and they're working, they can't really present to work with these diffuse areas of scabbing. And that's where this new technology, the Fraxel laser, comes into the picture.
So are you suggesting that with patients who have these lesions, you're going to basically treat the whole area in the face, for example?
Absolutely, and that basically provides two main advantages to the current existing treatment options we have. Number one, with the laser, we can treat a diffuse area such as the scalp or the face, and therefore not just do spot treatments, and therefore the actual yield of treating these precancers becomes much higher. In addition, the discomfort and the downtime is significantly lessened. Patients typically have about 2 to 3 days of redness with some minor swelling. Patients can typically go out the next day, and they don't have the scabbing and the blistering and the diffuse areas of sort of denuded raw skin that you have with the current treatment options. And therefore patients are much more, they're happier, they in addition have much more effective treatments in terms of getting rid of all the underlying subclinical lesions.
Now, is this akin to what we sometimes hear advertised in terms of new kinds of facelift, using the laser for a so-called facelift, or is that not a part of this picture at all?
The same technology, the Fraxel laser, can actually be used to get a mini facelift. This technology currently mainly is actually as well used to get rid of sun damage, people who have blotchy skin, people who have some fine wrinkling, people who have acne scars and surgical scars that want to get rid of. In addition, it can actually be used to get rid of much deeper wrinkles, not just on the face, but definitely off the face, on the neck, as well as the chest area, so it can actually tighten the skin. So it's a technology that can actually, patients, in addition to getting rid of their precancers, they'll get a dramatic improvement cosmetically in their appearance. with minimal downtime with that associated 3 days of redness. If you really do try to get rid of the deeper wrinkling, there is some more downtime with regards to some scabbing and some swelling, which typically lasts for about 4 days, but it is considerably less than any type of invasive surgical treatment.
Very quick question, we only have a few seconds left. Any dangers, especially if you get into the hands of somebody who's not very well trained?
It is a huge issue that patients should be aware of. I appreciate that you bring up that point. It's actually important that patients are treated by well-qualified, trained physicians. There are non-physicians who may get their hands on these lasers and can potentially, unfortunately, leave the patient with scarring. So it's important to...
All right, Dr. Ostad, I got to cut you off there because we are running out of time, but you made a very good point there at the end. Thanks for taking the time to be with us today.
Thank you very much.
And we thank all of you for joining us for this edition of Healthy Life. If you want more information, go to abcnews.com, click on the health page. I'm Dr. Timothy Johnson.